Hello guys, we're talking about elder abuse. Apparently yesterday was World Elder Abuse Day. Abuse is defined as intentional harm, that's perpetrating that harm or putting them at risk of harm. It could be intentional, it could also be unintentional. There are different types of abuse. We have the physical abuse. The physical abuse just means when you physically hurting them, like you're hitting them, you're kicking them, you're slapping them. It could even be at your own home, or it could be that they're in an institution like the nursing home, the hospital, in the community. That's part of abuse. You're restraining them without consent, because while you're restraining them, it could also cause harm, it could also cause cuts, tears, skin tears as well. So it's part of physical abuse. We also have another abuse also called sexual abuse. Guys, this sexual abuse, I wonder why people perpetrate this. I wonder why people do this. I don't know. Abusing an older ones could be sometimes the physical symptoms you see is that they could have bruises on the genital area. You could see them bleeding, such things like that. This is not, it's an abuse. It's uncalled for. Whether you're caring for the older ones, whether they are your relatives, you don't need to abuse it. You must not abuse the older ones. Another abuse is also called financial abuse, financial exploitation. From people, families, because the older ones, or the pensioners, sometimes they don't know how to use their debit card or their credit card, or they don't even check their balance. Some people use it, go for shopping, and come back. They wouldn't even tell them. This is one of the ways you're causing financial abuse. It could also be those in an institution like a nursing home. You're stealing from their property. Sometimes some of them comes with valuable goods. That's why in an institution, at the date on admission, you need to record what a resident or a service user comes on admission with. Record it. If it has a valuable, you need to keep it in a locked cupboard, so that when they are being discharged, or you give it to the family. Because one of the financial abuse is stealing, or when they lost their belongings, is part of financial abuse. So if you're a care assistant, if you're a care health worker, desist from that type of financial abuse. Because if you're caught, it's a legal case. It's a legal case. Another type of abuse you also want to discuss is elder neglect. Elder neglect, be it a form of malpractice or a form of negligence. Elder neglect can be from when you see them becoming malnourished or dehydrated because you're not feeding them well, and maybe those people that cannot feed themselves, like people with dementia, people with different types of stroke, they have paralysis or something like that, and they need an assistant to feed. You just bring the food or the drink, you drop it on the table for them without any form of assistance. That's an abuse. You need to assist those ones in their feeding, in drinking. Another neglect is when they come up with pressure sores. If they've got dementia, mind you, in dementia, they might be mobile, but a demented resident or a patient with dementia, their brain is not telling them, their brain is not working well. So their brain is not telling them, look, I've been in this position for a while, I need to turn myself. No, their brain is not telling them that. So you also, as a staff or as a care worker, need to reposition these people at most 4 hourly. You need to reposition these people. You need to treat their pressure areas in order to minimize the risk of pressure sores. And you see them neglect when they have been neglected, they're unkept. You're wearing them dirty clothes. You see them wearing dirty clothes. You see their rooms untidy. These are neglects. What of personal hygiene? You're not washing them. They're smelling. Incontinence. Some of them are incontinent. They passed feces on their body. The pad, they are with their pad, the feces on their pad or the diapers. The feces are on them, and you can't clean them from the feces. You let them be. They're incontinent of urine, they're incontinent of feces, and they wee on the pad, and they stay with them, get stuck on them. And there's a risk of pressure sores, risk of infection arising. So you need to take care of them. At least check on them, reposition them, check on their pads, change their pads at least 4 hourly. If it happens that you come to their room, even within an hour, and they've opened bowel, they pass urine, you need to change their pad. Let their pad be pads or diapers. In Africa, we call them diapers. Let their pads or diapers be clean and dry. Ensure they are tidy, ensure they are clean to minimize pressure sores, to minimize infection. These are many types of abuses. We've talked about the physical, talk about the sexual abuse, the financial abuse, the neglect, and there's also called the elder abandonment. Elder abandonment, even some relative does it. You're going out, you leave your older ones at home. Sometimes they lock up the door from them. You leave, you just lock the door from them. That's an abuse. Elder abandonment. You're not caring for them. You don't even provide an alternative of who will care for them. What if they have a fall in the room or in the house? What if they set off the fire? Yeah, because their brain is diminished. They have cognitive impairment, especially those with dementia. You let them with the gas, you let them with the electricity, anything can happen, and that's an abuse. They can even wander about. That's an abuse. You need to ensure that we take care of these older ones. Yeah, remember when we were young, they took care of us. When we were kids, they took care of us. And so this is our time to return that care, to take care of them, of what they have done for us. We need to do all we can, because over here in the developed world, it's really a legal case. You can't be self-guided against. And what is safeguarding? Safeguarding is just protecting the rights of these vulnerable ones. They call them the vulnerable ones. Yeah, they are vulnerable. Physically, they are impaired. It could be they had a stroke. Mentally, it could be they have dementia. They could have a chronic condition that make them not as strong as you are. So they need to be protected. Whatever race, whatever age, whatever sex, do not discriminate against them. They need to be protected. They have a right to no abuse. This is their right. They have a right to no abuse. So all care workers, we need to work on this. We need to do all we can. Yeah, sometimes we've got residents, sometimes we've got patients that wouldn't want to take anything from us, wouldn't want to eat. They keep declining their meals. They keep declining their fluids or drinks you offer them. Yeah, in that case, you need to have what? You need to report it, document it. It's an evidence. So that when there is any safeguarding case or any legal case, you've got evidence to prove that, look, I've offered her drink in so and so hour or so and so date, and he declined it. That's an evidence. You report it. If you've got a manager, report it to your manager that this is what is happening. Mr. A or Mrs. B has been declining to eat. That's why we have the food chart or the fluid chart. It's been declining to eat, it's been declining to drink. At least you have evidence. At least you've done your best. And then when you go back home, you know you've done your best. Your conscience is free. That when you come back, you say, oh, you worked on this shift and so happened, this has happened. So we need to, it's not easy, I know, it's not easy at all. And if they've got some residents, you know that there are risk of, or some service users or your patients, there are risk of pressure cells. Be they are diabetic, you know, the skin healing, it takes time. Their skins are so vulnerable, their tissues are vulnerable. So, and they don't want to be repositioned. You need to document it. Do a risk assessment for those residents. Document it, because this is evidence that you've done all you could and they declined. So, for this year, the World Health Organization and the United Nations, for these years, they have set up how to tackle abuse of older ones. They set up 5 priorities they are looking forward. They are looking at working on. One is to combat ageism. That's minimize the rate of the aged ones, the older ones. They want to combat ageism. And we know that the population of the older one, the aging population, is increasing every day. How do they want to combat ageism? It's not that we want to kill the old ones, but at least ensure their rights are maintained, ensure they are healthy, ensure they are not vulnerable to such acts of abuse. Another way they want to do it is to generate more data, to raise awareness of the problem. Some people don't know it's an abuse. Some people don't even think that they don't change the resident or the patient part is an abuse. They don't see it as an abuse. So when you want, some people lock up their old ones at home. Some people exploit them financially. They don't think it is an abuse. So when you raise this awareness to the masses, to the public, telling them this you're doing is an abuse and can put you in illegal action, they kind of are aware of it, and then it's kind of try to reduce it. Another thing they want to do is to develop and scale up cost-effective solutions. They bring about solutions in order to stop abuse of older ones. A solution that will be cost-effective. It's bringing out results, but it's economical. It's cheaper to use, and they will also want to think of if the money or if the resources are addressing this problem. Is the resources they are bringing out, is it addressing the issue of elder abuse? Another thing is raising funds to tackle these problems. Yeah, they need to raise funds to tackle this problem, because I know those of us that work in the nursing homes or in the hospitals, we are short staffed. We lack staff. And so the workload is heavy. It's too much on us. On a 12-hour shifts, the workload is heavy. So it happens that if a resident needs to be repositioned according to this time or at this hour, or they need to be fed at this hour, you won't be able to do it because there's a lot of work. That's not an excuse, but you need to do it. You need to do all you can to ensure that your residents are well taken care of. But then, short staff can bring about it. So it's another way to raise funds, to employ staff so that there is enough staff to take care of these old ones. Okay? So these are little things I want to say about this elder abuse. If you have committed elder abuse, knowingly or unknowingly, at least you're aware of what constitutes an elder abuse. We need to stop it. We need to stop it, because they said, according to statistics, they had it that 1 in 6 elder ones, those over the age of 60 years or 65 years, have experienced abuse. Have experienced abuse. 1 in 6 people, or the older ones over the age of 60 years, have experienced an abuse. So these are things, simple tips I want to share with us today. Bye. I remain your friend, Belinda.